Hello, welcome to BPS Live. My name is Steve Ronan. I'm a plastic surgeon here at Blackhawk Plastic Surgery, part of the premier plastic surgery network. And tonight we're going to talk about rhinoplasty. So we're going to have a video that I've created recently that we'll play. And at the end, we're going to have a Q&A session. But for now, let's go ahead and start our video. Let's talk about rhinoplasties or nose jobs. Rhinoplasties are a complex topic, but they're a lot of fun to talk about. There's some features of the body that are known for positive reasons, like, wow, those look great. And so that's why we would notice them. With noses, we typically notice things that we don't like crookedness or a big hump. And so when we create a nose, we need to create one structurally that fits with the shape of the face and the dynamics and angles of the face, such that the nose disappears and we just don't notice it anymore. That's our whole goal when we do rhinoplasty. A rhinoplasty or nose job is a surgical procedure that typically takes about an hour and 15 minutes. And what we do is we alter the shape of the cartilage and bone underneath the skin envelope. So essentially you have poles and a tent, and we rearrange the poles to have a better shape and allow the tent to redrape over a completely new shaped nose. There's three broad categories of rhinoplasty. A regular rhinoplasty, which is the outside, a septo rhinoplasty, which is the inside and the outside, and a revisional rhinoplasty, which is redoing one that's already had surgery or previous trauma. A regular rhinoplasty is a surgery that takes about an hour and 15 minutes. We go inside the nose and shape, remove, change, add cartilage, and adjust bone to create a new pleasing shape to the nose. Typical things that we work on are reducing the hump, making it more straight, making the tip more defined, narrow, correcting the tip that's drooping, bringing it out, and a whole variety of things that we might shape, change minimally or more significantly to create a nose that fits that particular face and then just disappears. Another type of rhinoplasty is called a septo rhinoplasty. And this is where we work both on the inside and the outside. So on the inside, there might be reduction of airflow or blockage or obstruction. And this might also look like chronic allergies for some people. And so we'll work inside either with the septum, the turbinates, or the internal valves to open up the airway to allow good airflow on both sides. And typically that makes the patient feel quite a bit better and reduces sometimes those allergy type symptoms. That's the inside. On the outside, we'll change the shape of the nose to make it more pleasing to fit that particular face, to have basically both the inside and the outside optimized. A revisional rhinoplasty is a more complicated rhinoplasty that deals with a nose that's previously been worked on and wasn't satisfactory. Common reasons for this would include possibly the wrong thing being done the first time, collapse of the nose, twisting or asymmetry, and or breathing problems. And so when we do a revisional rhinoplasty, we're typically adding grafts to bring strength into the nose, making sure that the airways are good, and then adjusting parts of the previous surgery to try to straighten it out or bring things more in line. Ideal candidates for rhinoplasty are those with either aesthetic or functional concerns. Aesthetic concerns are things like a hump, too big, crooked, leaning one way or another. And functional concerns would be breathing problems, snoring problems, collapse of the nose, or any type of functional issue with the breathing associated with the nose. Age range is pretty variable. So nose stops growing at 15 years old for women and 16 years old for men. And so from those ages up, we can do rhinoplasties. As long as the patient's healthy and is able to have, a relatively short, simple surgery, we can perform a rhinoplasty. Another concern is making sure that the patient's expectations before surgery match what we think we can do after the surgery. We need to make sure that those are realistic. And when we have realistic expectations and we do a good rhinoplasty, there's a high degree of patient satisfaction. Consultations in rhinoplasty are a little more complicated than some of the other things that we do. The first step is figuring out what's going on with that particular nose. Listen to what the patient's concerns are. Sometimes what they tell you and what's there are two different things, and we need to be able to understand that difference. And so we need to be able to look with our eyes and touch and figure out exactly what's going on with that nose. Absolutely critical as a diagnosis of the problem. The second thing is we need to mentally create an image of what we want. So where is this nose off the norm for this particular shape face? And so here's the nose that we want, and here's where we are. And very important step. Next is, what are the 38 things that I need to do to take this nose from here to somewhere close to this one? And what order should I do them? And so also super important. And then the last part is going to the OR and executing those 38 steps and maybe making some changes along the way, because once you get in there, it might be slightly different than you thought. And so for noses to be successful, you have to do all of those things in a row and have them all be spot on. Let's talk about the day of surgery for a rhinoplasty. So you'll get here pretty early in the morning, check in, takes about a half an hour, and we'll go back to the operating room. All of our patients go to sleep. We find that patients are much more comfortable and have a better feedback on the procedure when they don't really remember anything about it. So you typically make incisions along the inside of the nostril and then across this, what we call the columella. And that lets us lift up the hood of the nose and get inside. And on the inside is where we'll make all of our changes. And when we're done, we'll put it all back and typically put a splint on the outside. And if we've done internal work on the inside as well, patient will hang out with us for an hour or so. And when they're ready, they'll walk out and go home, do lots of icing this first week. About a week later, we see them, and then we'll take off all the splints. And from that point, we essentially just have to be very careful with the nose for a couple of months. There'll be swelling on the nose, and typically that'll actually increase after the splints come off. The swelling sort of drops off like this, so we'll lose a lot of swelling in the beginning, but some of the tip swelling will remain for really up to a year. Despite the prolonged swelling, most patients start to see significant results within a month of the surgery. And then as the swelling goes down and the tip refines, it gets sort of better and better over the course of that year. The two most common types or styles of rhinoplasty is closed versus open. So closed or reduction rhinoplasty is a little bit older, and typically the incisions are made on the inside and cartilage is reduced and the nose is allowed to collapse down into place. The problem with this style of rhinoplasty is that over the years, it can kind of keep collapsing and getting smaller and smaller, which can create airway problems. What I perform is an open or structure rhinoplasty. In this style, we're actually leaving the nose as strong or stronger than we found it. And we're typically putting little grafts in underneath that you don't see, or recycling the pieces that we remove to create a strong nose that will hopefully not move or change or collapse over decades. Let's talk about your recovery after you get home. Rhinoplasties, fortunately, are not associated with a big pain load. So it's pretty easy from that standpoint. You'll have multiple pain medicines. You really won't even need them all. We do lots of ice because one of the issues is swelling. And you're able to get up and move around. We just don't want you straining or leaning over too much or yelling or doing anything that would generate a lot of pressure in your face. But other than that, you can kind of kick back, relax. If you need to study or work from home, you can do that usually the next day. At 2 or 3 weeks, we can begin low impact aerobics. Nothing straining, but things like an exercise bike easily or on a treadmill. Running wouldn't feel too good because of the bouncing. And we'll sort of keep it with low impact aerobics until about 2 months. And then you're sort of free to do whatever you want as far as lifting heavier things. There's risks associated with rhinoplasty, just like any of the other procedures that we do. First off, there's general risks. Things like having anesthesia, infection, bleeding, or a problem with one of your organs. Fortunately, these are very rare. There's also specific risks associated with having a rhinoplasty, and those would be things like the shape not being exactly what you hope for, changes in the shape over time, problems with the airway, or perhaps swelling that goes on a little bit longer than we expected. Typically, all these problems are things that we can manage in the post-operative period. Most don't require any kind of revision, but perhaps some will. Here's a patient that complained of a hump, a tip that was sort of droopy and not defined. And so we make several small changes to have an overall effect. We've taken down the profile and smoothed that out. The tip, which was pointed from the side in a more downward project direction, we've opened the angle up and pointed it slightly up. Now from the front, that's going to show a shorter nose. It's going to expose more of the lip, and it's going to feminize the nose. And so the tip, instead of kind of coming this way, is going to kind of come up more this way. Also with the tip, we've taken it from a sort of more broad, wide tip to a more refined tip. So it reduced in the side dimension and the top dimension, coming in to bring a smaller tip that's aimed in a better direction with a smoother profile. This patient complained that her nose was too wide, there was a little hump, and wanted more tip refinement. And so when you look at her face, it's more of a tall, narrow face. And so for her, we can build a more narrow nose and it'll look like it belongs. So if you look at her hump, we've taken that down, it's very small. And when you look at her tip, it's a little bit bigger with a little less refinement, and it's aimed slightly downward. And so we've brought her tip up to give proper alignment, shortening the nose from the frontal view. We've refined the nose to make it more narrow and short. And then overall, we've brought the nose inward. And so that creates a more pleasing, narrow nose, which fits her face. This patient's concerns were more functional than aesthetic. So there were breathing problems, long-term obstruction. And so on the inside, we worked on the septum, the turbinates, and the internal valves. These are all things that you can't see from the outside. And with that, we're able to create nice airways that improve all the functional concerns. While we're at it, we made some adjustments to the nose aesthetically. Not major ones, we just straightened things out, created a little bit more tip definition, left a nice masculine looking nose. So that we've changed both the inside and the outside to make the patient happy. Over the years, I've done tens of thousands of surgical procedures. Rhinoplasty is one of the more common ones that we do here at Blackhawk Plastic Surgery. I hope you found this information useful, and if you have any questions at all, we'd be happy to answer them either in your own consultation or following this in the question and answer session. Thanks. I hope you guys found that video useful and had some good information. Go ahead and put your questions into the chat. We already have a few. Brett, you want to go ahead and start with the first one?
Definitely. I have one from Yvonne C. How much input do I have in determining the final appearance of my nose during the consultation process?
That's a good question. And so you have a lot of input, but we also will exchange ideas. And so one of the first things I'll do is without telling you anything about your nose, I'll just ask you all the things that you don't like. So I don't like my hump. I don't like the tip. I don't like the way it's crooked, or can't breathe. And so I'll ask all these questions to try to figure out what you're thinking and what you don't like about the nose. After doing that, I'll discuss what I think of it and how certain proportions might be impacting what you're thinking. And so, what drives your final result is going to be based on the aesthetic concerns of the patient and those things that are verbalized to me. So the answer is that really a lot of what you say has to go into what the final result looks like. We got another one?
Definitely. Aiden K asks, how will rhinoplasty affect my ability to breathe? And are there any functional improvements that can be expected?
Another great question. So how does rhinoplasty affect the function, the function and ability to breathe? Very important. So one of the things we'll do at your consultation is test your breathing and see what kind of airways that you have. And we'll talk about whether or not you think you have any obstruction oftentimes patients will have obstruction and not know it because it was so long lasting. It just became normal to them. And so we'll sort of talk about all those things. And during the rhinoplasty procedure, if you do have functional issues, then we can address those at the time of the surgery. And so we're typically improving someone's breathing ability or function during the rhinoplasty surgery. How about our next one?
Yep. One from our chat. What's the pain level of this procedure? From Malia.
A good question. So this is a relatively low pain procedure. Oftentimes our patients are just taking Tylenol and Motrin within 24 or 48 hours after surgery. You would think, or I would think, that this surgery hurts quite a bit because you're working sort of in the center of the face. But for whatever reason, rhinoplasties don't really hurt that much, surprisingly little. So compared to other things I do, like breast augmentations or tummy tucks, those have tremendous, in relative amounts of pain. But rhinoplasties, very little.
Great. Aaron asked, besides nose jobs, what other facial improvement procedures does your practice offer?
Pretty much everything. Sort of starting top to bottom, we do lots of hair and hair transplants, brows, eyes, nose, faces, necks, really the whole gamut, ears, so virtually everything. And so probably the top 5 things that we do here in my office would be facelifts, noses, tummy tucks, some sort of breast, and a hair transplant.
I have another question for you, Dr. Ronan, from Ryan. How long does the recovery process typically last? What can I expect during that time?
Initially, you can expect that you'll have some swelling and bruising, and you'll have a splint on. That splint stays on for about a week, at which point we take that off in the office. The bruising and the majority of the swelling will dissipate within a week or two. But some of the tip swelling will last much longer. So the swelling kind of drops like this, with a lot of it coming off in the beginning and a little bit lagging on for quite a while.
Definitely. I have more questions for you. What are the potential risks and complications associated with rhinoplasty, and what should I be aware of? From Isabella.
So risks of nose surgery are the same as other types of surgery. So sort of generic things like having a heart problem or lung problem or, having a complication with anesthesia. Fortunately, those are, very low risk, and we'll sort of make sure that you're qualified to have the surgery before we go ahead and do it. Specifically to noses, you can have a shape that you really don't like, right? So it might be that we create a nose and we're not exactly what you were thinking. That doesn't happen very often, but possible to happen. You'll have some numbness in the tip of the nose that will stay typically temporarily. Over a period of time, it will come back. Could have bleeding after surgery that we have to go and maybe pack the nose for, or something like that. That's pretty rare. Can't really remember the last time we had that. So, but overall, it's a relatively low risk procedure.
I have Jackie here. I had surgery in 2020, and wearing masks affected the shape and healing of my nose. Am I a candidate for reconstruction?
Yes, probably. It's a good question, and I want more information to be able to answer it. So the first thing that comes to my mind is I can't imagine a mask did it. So, possible, but probably not. So there might be another reason that something didn't turn out how you wanted. And so we need to sort of investigate what you did and what your anatomy was, what you did, and then examine what's going on right now. And then piece together exactly what didn't go the way you wanted, and then take a corrective plan. So, yes, it's possible to do that. It's been 4 years for you now, and we typically won't want to do a revisional rhinoplasty within the first year. Waiting is good, and you've been 4 years now, so that's plenty of time. So we're happy to take a look and help you out.
I have another one from Mason. How soon after rhinoplasty can I expect to see the final results?
Good question and difficult question. So you will see changes when we take a splint off. It'll be different right then, and you'll see it. But you'll carry some of the swelling for a period of time. Most of the time we're making noses smaller, and then they have a little swelling. And so as the swelling dissipates, you sort of like grow into your new nose, or you shrink into your new nose. And so the final result is probably at a year, but you get very close to that quickly. So the changes happen very, very quickly in the beginning and then very slow as time goes on. And so we typically will say a final result is at approximately a year.
I have a question from Harper, and I'm so glad they asked this because we get this all the time. Are there any age restrictions or recommendations for individuals considering a rhinoplasty?
Yes. So that's a good question. So for women and men, we typically will do rhinoplasty starting at 15 and 16 years old, because for women and men, that's when the face is fully grown. And so we'll wait till at least that age before attempting the surgery. But typically we don't do them that young. Most of the younger kids that we do will be ones that are getting ready to go to college and aren't quite 18 yet, or they're getting close to it. So we can start that young, and we can go up to whatever age is safe to operate on. We've done noses on patients that are, in their 70s and, plenty of times before.
I have one from Heather. I had a thread lift done last May and realized after that I'm ready for the real deal. Would these threads impact my ability to have a rhinoplasty done? And if so, for how long?
Interesting question. So I don't think the threads will impact us at all on a rhinoplasty. If I'm guessing that the threads are out on the cheeks and not in the nose. If they are in the nose, I would just remove them at the time that we were doing that. If they're in the cheeks, they're probably not going to impact us. But I'm glad you said that you want to do it the right way, or because not a huge fan of the threads. And I think that your comment was right on.
Amy says, where do you perform your procedures and who assists you?
Okay, good question. We do that right here at the Blackhawk Surgery Center, which is within our office. And that's a fully accredited surgery center, both by Quad ASF and Medicare. We use an anesthesiologist for every procedure. And so he or she will put you to sleep, and you'll have a professional watching you the whole time. There will also be a nurse in the room who sort of assists us with everything. They're called a circulating nurse. And then I'll have a surgical technician who is actually handing me the instruments and sort of helping me during the surgery. And that's our team.
Sophia asks, are there any non-surgical alternatives to rhinoplasty that I should consider?
So if you think about fillers, which have been more popular for a non-surgical rhinoplasty. And so a filler provides volume. And so if someone's at a deficit of volume, then you can use filler in those areas to fill in and maybe straighten out a line like a profile. What fillers don't do is make something smaller. So if you have like a large hump, a filler is not going to remove that. Or if your tip's really big, a filler is not going to make it smaller. So, but if you have on your profile a depression, or it starts a little bit low, you can use a little filler to kind of bring that in line. And so, yes, there are some non-surgical things. Doesn't work for everything, but it does work for a few things.
We have a question from Danette. 2 months post rhinoplasty, there's a bump felt. Very tender on the bridge of the nose. Is this part of healing? When should I have concern?
Not sure. So one, I don't think you're one of our patients, but maybe. So it's, I would maybe have a better handle on it if I had done the surgery. But it's something that you examine and look at and then determine what that is. a lot of times based on the feel of it. Is it a little tiny chip of bone or a piece of cartilage? Is it just a little bit of swelling? And so you need kind of an exam to look at that and see if we can determine exactly what that is.
All right. And Lonnie, Dr. Ronan, can you please tell us more about your medical training and experience?
I went to school at UC Davis for undergrad. I was a physiology major and drove an ambulance full-time when I was in college. Then went back to Virginia for medical school, internship, residency in general surgery, and then my fellowship in plastic surgery. And so I was at one of the larger hospitals in the country, and it was kind of one of these crazy places with tons of people everywhere. As I was leaving, they built a 14-story building of ICUs and ORs. So it's just a gigantic place, and gave me a pretty wide variety of things. They did a lot of cardiac surgery, transplant, vascular trauma, lots of trauma, general surgical oncology, vascular, all neurosurgery, ENT. Did sort of all of those things for a while, and then at the end specialized in plastic surgery. So it was a pretty fun program and a lot of fun along the way. So do we have one more question, or?
I have one more question.
One more question.
From Rebecca. Is it possible to reshape just the tip of the nose?
So if it's just the tip that needs work, yes, we can do that. But if you think in proportion, if you make one thing bigger, another looks smaller. If you make another thing smaller, the other thing looks bigger. So if we make your tip smaller, the dorsum or the profile will then appear bigger. So if your profile is appropriate and then your tip's big and we reduce it down, that'll work as just tip rhinoplasty. But we'll need to sort of talk about and think about, if we reduce your tip where you want, will it now make your dorsum look too big? And so then we would need to work on that as well. So it's all about keeping proportion from top to bottom and making sure everything works together. Okay, so that's enough questions for tonight. We're going to go back to Brett, and we're going to talk about the raffle. So Brett, you want to take that away?
Yeah, thank you. Well, because you attended this live event with us, we do have some raffle prizes. You can win one hydrofacial treatment, a laser genesis treatment, a $1,500 gift certificate for a surgical procedure. Winners are going to be contacted tomorrow. You can reach us at our office at 925-736-5757. And we're so excited that you're able to attend. I'm going to give it back to Dr. Ronan here.
All right. I told you there was going to be a special guest, and with a perfect little nose. This is him right here. This is Tahoe. He's our English golden doodle and kind of the mascot at our office. And he definitely has a cute little nose. And
yes, he does.
He's here hanging out with us pretty much every day. But I want to thank you guys all for tuning in tonight. And if you have any other questions or you'd like to talk about rhinoplasty, just come on in and talk to us. Thank you very much, and good night. Bye-bye.
Good night.